Your daily medications might be stealing essential nutrients from your body, creating new health problems while solving others. Clinical research has identified over 200 medications that deplete specific vitamins and minerals critical for optimal function. While you carefully manage your health, have you addressed the nutrient deficiencies your medications might be causing daily? You're currently experiencing the effects of potential nutrient depletions without recognizing their connection to your medications. American Journal of Medicine studies indicate up to 30% of medication side effects may be related to drug-induced nutrient depletion. For someone committed to health optimization, these unaddressed deficiencies potentially explain persistent symptoms despite your best health efforts. Each year of unaddressed nutrient depletion increases your risk of developing seemingly unrelated health issues while potentially reducing your medication's effectiveness. In some cases, these deficiencies can accelerate the very conditions you're trying to manage. By the end of this video, I'll share the single most overlooked strategy that both optimizes your medication benefits while protecting your long-term health, a strategy most pharmacists and physicians aren't trained to implement. Hello, I'm Dan, a pharmacist with over 40 years of experience specializing in medication optimization and nutrient interactions. I've helped thousands of health-conscious individuals like you maximize their medication benefits while minimizing hidden health costs. If you're watching this, you're likely someone who takes your health seriously. You research your conditions, you're proactive about prevention, and you're willing to invest in quality health care. Perhaps you're taking medications for blood pressure, cholesterol, acid reflux, or managing a parent's complex medication regimen. But here's what makes you different. You're not just interested in managing symptoms, you want optimal health and longevity. In the next few minutes, you'll discover which common medications are most likely depleting your essential nutrients, the subtle warning signs your body may be giving you right now, how to protect yourself with a personalized nutrient protocol, and why traditional pharmacies often miss these critical interactions. Now, according to a comprehensive review published in the Journal of the American College of Nutrition, over 200 commonly prescribed medications directly impact specific nutrient levels. Yet in a survey published in Clinical Pharmacology and Therapeutics, fewer than 10% of physicians and pharmacists reported receiving adequate training to identify and address these interactions. Let's start with some medications you might recognize. Statins, prescribed to millions for cholesterol management, deplete coenzyme Q10, essential for heart health and energy production. The irony? You're taking a medication for cardiovascular health that potentially compromises your heart's energy production. Acid reducers like omeprazole or Nexium block B12 absorption and deplete magnesium over time. These deficiencies can lead to neurological symptoms, fatigue, and even heart rhythm disturbances. Blood pressure medications, particularly diuretics, flush out essential electrolytes like potassium, magnesium, and zinc, affecting everything from muscle function to immune health. And if you're taking metformin for diabetes management, you're likely experiencing B12 depletion, which can masquerade as neuropathy, often mistaken for a diabetic complication rather than a medication side effect. The challenge is that nutrient depletion symptoms often develop gradually and mimic other conditions. Fatigue, muscle weakness, mood changes, or cognitive fog might be attributed to aging or stress when they're actually signs of medication-induced deficiencies. And what's particularly concerning is how these deficiencies create cascading health effects. For example, a magnesium deficiency affects over 300 enzymatic reactions in your body. CoQ10 depletion impacts cellular energy production throughout your system. And B vitamin deficiencies affect everything from neurological function to energy metabolism. These aren't just minor inconveniences, they're fundamental disruptions to your biochemistry that compound over time. The good news is that with proper assessment and a personalized approach, you can maintain both the benefits of your medications and your optimal nutrient status. And this requires 3 critical steps. First, a comprehensive medication review that specifically looks for potential nutrient interactions, not just the typical drug-drug interaction check you get at a traditional pharmacy. Second, targeted laboratory assessment to identify your current nutrient status, not just standard blood work. And third is a personalized supplementation protocol that accounts for your medication, your specific medications, the dosages, medical conditions, and biochemical individuality. Now at RxVIP, we've developed a proprietary assessment protocol that identifies potential depletions before they manifest as symptoms, creating a protective nutrient shield around your medication regimen. We've created a free medication nutrient interaction guide that you can download right now. It outlines the top 20 prescribed medications and their nutrient implications, along with a checklist of potential depletion symptoms to discuss with your healthcare provider. Just click the link below to access it. Earlier, I promised to share the most overlooked strategy for optimizing your medication benefits while protecting your health. Here it is: proactive nutrient mapping. This approach flips the traditional medication management model. Instead of waiting for deficiency symptoms to appear and then trying to identify the cause, we map your medication regimen against known nutrient interactions, create a personalized supplementation protocol, and monitor key biomarkers to ensure optimal levels. This proactive approach prevents deficiencies before they impact your health, rather than treating them after they've already caused problems. If you're taking multiple medications or concerned about potential nutrient depletions, I invite you to schedule a comprehensive medication and nutrient review with our clinical team. And during this consultation, we'll analyze your complete medication regimen, identify potential nutrient interactions, and create a personalized protection plan. Visit our website to schedule your review. If you're managing medications for a parent or loved one, we also offer family consultations as well. Imagine removing that unexplained fatigue, improving your cognitive clarity, or enhancing your exercise recovery by simply addressing the hidden nutrient gaps in your current regimen. The relief our patients express when they discover that persistent symptoms weren't just aging, but addressable deficiencies is truly remarkable. Remember, your medications may be creating nutrient deficiencies that undermine your health goals. These deficiencies often manifest as subtle symptoms mistaken for other conditions, and a proactive, personalized approach can protect your nutrient status while maintaining medication benefits. I'd love to hear from you. Have you noticed any unexplained symptoms while taking long-term medications? Share your experience in the comments below, and I'll personally respond with some insights. Thank you for investing in your health knowledge. This is Dan from RxVIP, and I look forward to helping you optimize your medication experience. Thanks for watching. Hit subscribe to get more medication management insights. Here's another video I think you'll like.